Okay, hi, so this is Sarah and I'm back with another episode of Asking for a Friend. I was actually asked my thoughts on using various devices for internal self-treatment. So I have a lot of opinions about devices for internal self-treatment. It would depend on what it is for. So I am a huge proponent of finding the appropriate functional tool to help grade your exposure back to your full functional capacity. So what I'm speaking of there is if you're having issues with penetrative sex, there are ways to grade the exposure to size, speed, depth, everything like that. And almost anything there would, from your friendly local sex shop, would do fine. The other main area where people are using internal devices for treatment involve the treatment of tender spots or trigger points. And I also have some opinions there. So one, this is what we tend to use here at Entropy. It can vibrate if you put batteries in it, but it's kind of a little delicate bend and can work well. Another tool that we don't actually have here right now is a TheraWand, and it's an S-shaped tool to help. It's actually quite handy to get over the levator ani muscle, and you can feel different things, but you can also almost do like an internal massage if that's something that feels good. If it's creating more pain, I would suggest that perhaps another treatment option would be desirable. That being said, the second part of the question was, do I actually use them here in the clinic as opposed to just like, hey, buy this and figure it out at home? The short answer is yes. I will help a client or a patient learn how to maneuver the device, because even though, especially us ladies, I'll speak mostly to females just now, everything is with us, but it can be a little bit hard to map it out and a little bit awkward actually physically to do it. So if you're thinking about doing some superficial tissue manipulation, actually it's not terribly hard to use your thumb to do such things superficially. So maybe postpartum, some scar tissue or some tightness after delivery, can use that fine. But if you're working to get something a little bit deeper, like the levator ani muscles, I'm a tall girl. If I just reach my hand down, I am not going to be able to reach anything internally without help. And so that's where the idea of devices comes in, but it still really wouldn't work without some kind of finagling. Sometimes we'll have people lie down, but I think something that really does need to be addressed is that even reclining or lying down, it's still going to require a bit of an interesting effort in order to get the device where it needs to be and to have the rest of the patient be in a semi-comfortable position where they can work on relaxation or anything like that. So I think that these guys can have a place. I think that if they're going to be recommended for home use, they are used in the clinic so that the person going home to use it feels confident and not confused. And then finally, it just needs to be taken into consideration that the positions people need to get in to use these may not necessarily be the most comfortable for other body parts that may or may not have issues going on. So same thing with the TheraWand, real quick. It's an S shape, and maneuvering a piece inside of you with your hand on the outside can actually get a little bit confusing. And there's not a worse surprise, really, than getting yourself poked accidentally on the bladder. So figuring out how to maneuver a tool that isn't going to hurt more or surprise anyone in a bad way is really helpful before you send them home. So do I use tools when appropriate, when the patient would like to and feels comfortable doing so? Absolutely.